So Dr. Arlette Herry serves as the Vice President for Multicultural Affairs, Interim Dean of the School of Arts and Sciences, and Chair of the Department of Medical Humanities and History of Medicine at St. George's University. Across these leadership roles, she advances a unifying mission, fostering inclusive environments that addresses inequities in health education and broader social systems. A health psychologist by training, Dr. Harry's scholarship centers on the health equity, sense of belonging, aging and older adulthood, stress management across the lifespan, and minority stress, with particular attention to how structural and cultural context shape mental health outcomes in underserved populations. Her peer-reviewed publications include research on vaccine hesitancy and the psychosocial determinants of health behavior. In addition to her research, she leads institutional initiatives within student and faculty development, delivering training on implicit bias, psychological safety in the classroom, and culturally responsive engagement with marginalized communities. All right, so we're happy to have you here on Dr. Harry. So the floor is yours.
Thank you, and thank you for having me. Good afternoon to everyone, or good evening, depending on where you are, and maybe good morning, depending on where you are. Happy to be here and to look at this from a training lens. We were really excited about offering a palliative care certificate, caring where it matters most, and this is collaborative. If you would notice the three names on the screen, I'm a health psychologist. Dr. Telesford is a public health specialist, and Dr. Tamara Green is a community-based palliative care physician and consultant in psychosocial oncology. What we're really passionate about regarding this initiative is that it was developed through a close partnership between academic institutions, St. George's University, and medical stakeholders, because we wanted to ensure that we're capturing the educational rigor and the clinical realities in this course, right? And one of the things that we want to make sure is that we are addressing unmet needs through compassionate, holistic care, remembering that we are providing support for the patient. It's not about the disease. It really is about the patient, and the patient, as we well know, human, multidimensional. And so ensuring that we provide support in that way. It is aligned with the SDG, good health and well-being, and really highlights the need for integrated care across the disease trajectory. So as we're in this short space of time, I know it's rapid fire, I want you to think about, keep this farmer in mind. John is a 60-year-old farmer he's a third generation farmer. He has always provided for his family and been a productive member of society, and is now diagnosed with prostate cancer. So yes, he's dealing with the pain and fatigue that comes with this disease, but also the uncertainty about his family and his future, that sense of loss, a sense of independence. And then let's not forget that his family may be unsure as to how to help him, right? This is all uncharted waters for everyone. So as we're just talking briefly about this, I want you to think about this farmer. The land still calls me, but my body cannot answer. And that's why training, interdisciplinary palliative care training, needs to happen. We're building capacity in cancer and end-of-life care. We're also wanting to build capacity just in providing this support for persons going through challenging times with illnesses, right? So it's not just about end-of-life care, and it's important to make that distinction, recognizing that, yes, hospice care is a part of palliative care, but we cannot neglect the persons who, let's say, for example, had surgery and returning home and having to reintegrate into their life. Integrating psychosocial and cultural competence. we want to make sure that, yes, as we're looking at giving particular attention to the needs of patients in geographically isolated populations, where we know that access to timely diagnosis and treatment and palliative support is especially limited. So really wanting to help from a training perspective to train our professionals. So when we're talking about professionals, healthcare professionals, we are talking about our physicians, our nurses, our social workers, our psychologists. And let's not forget the pastoral care, right? As I said before, we are dealing with humans and all of those needs. So spiritual need also has to be addressed. And in so doing, we're really hoping to strengthen our health systems. So this training certificate in palliative care is really about building capacity for compassionate person-centered care. We're starting with a certificate. It's going to be stackable, meaning down the road, we'll be offering a diploma, and hopefully further into the future, we'll be looking at a master's. But this training really is framed with a simple but powerful premise that palliative care is not just about death, right? It is about living well despite serious illnesses. Across settings, when we're looking at LMICs, we know that access to care remains limited. And so this certificate program is building the knowledge and skills and compassion across health professions. We want to make sure that this training is practical, it's culturally sensitive. We have to acknowledge the cultural nuances in our region around illness and death and dying. As I mentioned before, not neglecting the psychosocial and spiritual care. And really that interprofessional teamwork, I cannot stress that enough. I really want us to think about this as a village. It's going to take a village to support our patients, and definitely adapting strategies to local needs and constraints. So what does that program look like? It'll be interactive workshops and using real world case studies, reflective exercises, and we really want to include those reflective exercises because that would encourage our participants to connect deeply with the human experience of illness and dying and grief. And then we want to make sure that as a part of this training, we are including caring for ourselves as professionals in an emotionally demanding setting. So some of the courses, just briefly, would be the principles and practice of palliative and hospice care, healthcare professional well-being, psychosocial, cultural, and spiritual care. What are we hoping in terms of impact? That this course will be accessible across LMICs. It'll be flexible for working professionals. We did send a survey out there, and what persons were saying is that they wanted this to be self-paced. So definitely that's the route we're taking. It will be scalable, as I said before, and immediate application in our settings. So by bringing together the expertise of academia and the lived experience of our healthcare providers, the program really, what we're hoping is that it stands as a model for collaborative innovation in palliative care education. So we're hoping that the outcome of this training, we would see marked improvement in confidence, collaboration, and quality of care. And more importantly, we hope that participants will report feeling better prepared to meet patients and families with presence, compassion, and purpose, even when resources are scarce. And our commitment is that this course is to ensure that no one faces serious illness alone or in pain, no matter where they live. Please contact us if you have any questions. Once we're ready to launch, we will be sending out to your CMOs, your ministries of health. But yes, drop us a note. We'll love to hear from you and add to the growing list of persons who are anxiously waiting the launch of this certificate. Thank you for your time.
Thank you very much, Dr. Harry, and a very much needed and timely training certificate indeed. My own experience, well, I'm not a clinician, but I attend for a lot of these meetings on cancer, especially in the developing world. And whenever we talk about palliative care, usually persons just start to shrug their shoulders, and there's a feeling of helplessness. And I hope that this will, be a step forward in the right direction. Right, so we'll take maybe one question, and if they're really short, we can squeeze in a second one, online and in person. Go ahead, Naomi.
Afternoon, what is the estimated cost of that course?
So that is something that we are working on right now. The plan is again to make it accessible. So as soon as we get that costing, we will send out, we would disseminate as well, but it would not be cost prohibitive. The whole point about creating this certificate is to build capacity. So
Thank you.
that's the plan, is to make it accessible to all.
Okay, thanks.
You're
All right, we
welcome.
have a question in the room.
Would it be would it be available for the layman person without any medical experience?
At this point, no. It would be for healthcare professionals. So whether from the psychosocial perspective or the medical perspective. What we were thinking of doing eventually is to create maybe micro credentials that we can offer to community stakeholders. But no, at this point, it would be for healthcare professionals. So your physicians, your nurses, your social workers, your psychologists. Yeah.
Okay, wonderful. So, I really like those questions and answers. In the interest of time, we have to move on. But thank you very much, Dr. Harry. I know you're physically in Grenada, so we'll have more than enough time to chat afterwards.
All right. Thank you for having me.
No problem.